All right, so here we have a RAD-G pulse oximeter. Now we're going to use this to monitor the baby's heart rate and oxygen saturation. So the first thing you want to do is go ahead and turn this on the upper right. That's where you'll find your on and off button. This has approximately 20 hours of battery, but you always want to have it plugged in unless you're traveling. So your power supply is going to go plugged in right here. So you plug it in down here, okay? And this end is going to go to the wall. Now, as I mentioned, you're going to have your oxygen saturation right here on the left, and your heart rate is going to be monitoring on the right. The way that you know if you have a good clear signal is you're going to see the normal wavelength going on along the monitor. So here you have your patient cable. Always treat these with extra care because they're a little sensitive, so they tend to break off. So you're going to see there's a flat portion right here with like a metal chip. You go ahead, you plug this in here, and you clip it down. Okay? Make sure you never grab it through here or yank at it. Always flip this top open and then pull it out. And on this end, we have our probe. So what you want to do is untangle this here. Okay? So again, we have this metal chip looking thing here. So we connect it, we insert it here, and now we're ready to put it on the baby. So typically what you want to do is you want to wrap this around the baby's toe, or if the baby is a little smaller, you can also put it on this part of their foot on the top. So once you unpeel this here, okay, you're going to see there's an infrared light. That's how it picks up the signal. So you're going to put it around. I'm going to do it on myself so you guys can see. The light is going to go right on my fingernail, and we're going to wrap it around. Okay. And wrap it around here. And then in just a few, if we can take a look here, you're going to see how that wavelength that I was talking about comes about on the monitor. Okay? So right here, we should be seeing my heart rate and my oxygen. It looks pretty good. So anything, let's say we're set at a parameter of 90, which is our alert, and it goes off, what we want to do first is go into the bedroom or wherever the baby is and check on the baby first. We'll deal with the alarms after. So we want to make sure the baby has a good color, that the baby is breathing, that the baby is responsive, and then we'll deal with this. So just like it went off now, because I took it off, there's a red alarm button on the top left. You just press it and you silence it. But again, I want to emphasize, it's very important to pay attention to the baby first, and then we'll take care of the equipment. Okay? When you're traveling, you have this bag here. Okay? It's made to pack everything up. You can put your monitor in this slot here. You put your charger up here, and your accessories as far as the patient cable and your oxygen probe go in here as well. If you ever have any issues, any malfunctioning, you see that your equipment is not charging or your probe is malfunctioning, anything of that sort, always remember to contact your DME provider, and they'll be able to assist you with anything. All right, and that would be the conclusion of the pulse oximeter training.